Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. For a radio audience tuning in at WYAD 94.1 FM and WYADonline.com, we're glad that you all can be with us. Also, tuning in online worldwide via our podcast at iHeartRadio and Amazon Music. We're glad you all could be with us as well. This is part of a music and news segment here at WYAD, and today we're talking about something we've been discussing quite a bit during the month of May. May is recognized for a lot of things, including Mental Health Awareness Month. And one of the reasons why we're talking about this is that CMS wants to remind families that enrolling in Medicaid and the CHIP program will provide coverage for important mental and behavioral health services available both in person and via telehealth as well. Here to talk to us more information about that, we're excited to welcome Dr. Jessica Lee to our broadcast. Dr. Lee is the Acting Chief Medical Officer for the Center for Medicaid and CHIP Services. She's going to also let you all know where you can go for more information to see if this is something that applies for you. Dr. Lee, thank you again for the time. Really appreciate it.
Thank you. Thank you so much for having us and the opportunity to talk about how Medicaid and CHIP can help support the health of our children.
Yeah, it's such an important topic, Dr. Lee, and I think that the main reason why we wanted to have you all on is to share information, because our audience may not even be aware, if they have these programs already, what it may cover. So let's begin there. What are Medicaid and CHIP, and what type of services are covered under these programs?
Medicaid and the Children's Health Insurance Program, or CHIP, offer free or low-cost health coverage for eligible children, teens, and adults. Medicaid and CHIP cover more than 38 million children in the United States. That's nearly half the children in the country. And among the wide array of services for children and adults, for children and teens up to age 19, Medicaid and CHIP cover behavioral health services like mental health services, doctor and hospital visits, prescriptions, immunizations, eye exams, and all of the other care that children and teens may need in order to grow and thrive. May, being Mental Health Awareness Month, is a great time to highlight the different ways that Medicaid and CHIP coverage and services can help support families and children.
Yeah. So, Dr. Lee, an obvious question maybe for our audience is who is eligible for these programs? What are the criteria for them?
This is a great question. Both children and adults are eligible for these programs. Medicaid and CHIP programs are in each state, and they provide health coverage for children up to age 19 in families with low and moderate incomes. Eligibility generally depends on how many people are in a household and household income. While it varies by state, in most states, children up to age 19 with family incomes of up to $80,000 per year for a family of four may qualify for Medicaid and CHIP. Even if you've applied before and haven't qualified, you or members of your household may now be eligible. And even if you don't qualify, your children may be eligible. So it's really important that people check out their opportunities. And they can do that by visiting insurekidsnow.gov or calling the number 1-877-KIDS-NOW, where they can find enrollment information for their state.
Well, that's great information, Dr. Lee. We're going to remind our audience of that definitely at the end of the segment. So, when we've had individuals come on in the past, especially anything dealing with programs, typically there is an enrollment period. Is that the same when it comes to Medicaid and CHIP?
For Medicaid and CHIP, enrollment is always open. Families can apply for Medicaid and CHIP coverage at any time of year. But we don't want people to wait until the last minute. You want coverage to be there when you need it. It can provide peace of mind that the coverage and services that you might need at any time are there for you. So sign up now if you're not already covered, and make sure that you're getting enrolled in the programs that you're eligible for.
We were talking about May being recognized as Mental Health Awareness Month, Dr. Lee. So let's talk a little bit about how that does with young people. Why is it so important for children and teens to have access to behavioral health and mental health services?
So unfortunately, we've seen children's mental health issues increase in the last decade. The majority of mental health disorders arise during childhood, adolescence, or early adults, and they can interfere with the way that children and teens typically learn, behave, or handle their emotions. Recent data has shown that about 1 in 5 adolescents reported symptoms of anxiety and depression, and another survey showed that 42% of high school age kids reported feeling so sad or hopeless that they stopped participating in regular activities. So ensuring children have access to the care they need to stay healthy is especially important given these latest trends. And Medicaid and CHIP can help support children and teens through early screening and intervention and providing access to essential behavioral services, including mental health, to help them live healthy lives.
Well, such an important conversation, Dr. Lee, and I'm so glad that we could have you here to be able to discuss it with us. Again, everyone, Dr. Jessica Lee has been our guest. She's the Acting Chief Medical Officer for the Centers for Medicaid and CHIP Services, helping you guys understand not only, of course, the importance of Medicaid and CHIP, who qualifies for them, but also what they're able to cover, including when it comes to for mental health services as well. Dr. Lee, you mentioned this earlier, but let our audience know again where they can go for more information.
Sure. So you can find more information at the website insurekidsnow.gov or by calling 1-877-KIDS-NOW. The website has specific coverage for each state, and you can click on Find Coverage for Your Family for more information about your state.
All right. Well, Dr. Lee, thank you so much for the great work that you're doing and for sharing this information with us. Really appreciate it. Looking forward to having you back on the program again.
Thank you so much. We really appreciate it, too.
Yeah, the pleasure is definitely all ours, and we thank your audience for tuning in to another great segment of Conversations Live, again, part of our Music and Youth segment here at WYAD. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live, and let's go make today amazing. Take care.